Presiding Officer, and I'd like to thank the Cabinet Secretary for your statement today, and also like to add my thanks to all those people working in community and primary care right the way across Wales. Just to pick up, Cabinet Secretary, the £5 million of recurring funding for community allied health professional services. It'd be interesting to know from you how that money is allocated across health boards across Wales and how the Welsh Government tracks that to measure on deliverability across the service. The statement indicated that primary care professionals are managing increased patient load and offering a broader range of services closer to home. Yet the data from the BMA Save Our Surgeries campaign reveals concerning trends. As of the 31st of March last year, the number of GP practices in Wales decreased from 474 down to 374, a reduction of 100 surgeries, and the full-time equivalent number of GPs has declined by 25% since 2012, with a further 3.8 decrease since the campaign's inception in 2023. So given these statistics, Cabinet Secretary, how does the Welsh Government plan to address the diminishing number of GP practices to the escalating patient-GP ratio to make sure that people can have that efficient care right the way across Wales? Because we've heard examples, haven't we, from members like Alan Davis up in Blaen y Gwent about the Harley Street practices, about the number of people they're seeing and the number of GPs available. The Government's commitment to upskilling healthcare professionals is very commendable. However, the Royal College of General Practitioners has highlighted some significant challenges that in 2024, nearly 20% of GPs reported feeling stressed and unable to cope with most days, and over 40% experiencing such feelings at least once or twice a week. And more than 40% of GPs are considering leaving the profession within 5 years, citing work-life balances and the stresses of primary factors. Given these statistics, Cabinet Secretary, what measures is the Welsh Government implement to improve the retention of GPs and their well-being to ensure that we invest in training and it does translate into sustained patient care across Wales? You mentioned about optometry and pharmacy services, and the expansion of those services is a positive development, something that we on these benches welcomed. However, the effectiveness of these services depends on public awareness and accessibility, doesn't it? Public Health Wales introduced the new Primary Care Clusters dashboard in September last year to aid in the planning and address inequality. So how is the Welsh Government utilising this dashboard to promote and monitor the effectiveness of the expanded optometry and pharmacy services to make sure there's equitable access for all communities? And as I said, we need to ensure that people know that these services are out there. You know, there's a lot of people who I speak to don't know about the Common Ailment Service, and actually they can go to their GP practices, their pharmacies, to actually get these sort of conditions, like say sore throats, and different things, so chest infections, for example. So it's good to know what the Welsh Government is doing to promote that across the system. It did touch, the statement did, on dentistry. While the statement notes that over 420,000 new patients receive full dental treatment since April 2022, access to NHS dentistry remains a concern. The Royal College of GP's 2004 General Election Manifesto emphasised the need for sustainable career options in NHS dentistry. So what strategies are being implemented to make sure that NHS dentistry is an attractive and sustainable career choice? Because many of the dentists that I speak to say that they can't afford to continue doing what they do now. And you said about the contract reforms coming in place, you hope to be in place by September 2020, by the end of 2026. You know, this has been ongoing since 2021. The now First Minister Lynyd Morgan made a statement on this in 2021, saying it was going to be done and dusted very shortly. So we'd like to know what assurance you can give to the dentists across the country that this is going to be addressed. And also on dentistry as well, there's a growing concern about dental decay in young children across the country. You know, 32.4% of children in Wales are presenting with dental decay compared to 23.7% in England. So I'd like to know what more you're doing to improve access for children into dentist services as well. So I want to talk just a bit more about community care services. The addition of over 100 allied health professionals positions and the 49 full-time district nurses is encouraging. I just want to pay tribute to the role of our district nurses. They do an absolute fantastic job across our community. However, the Health Education Improvement Wales Strategic Workforce Plan for Primary Care highlights the need for ongoing workforce stability. So how is the Welsh Government ensuring the long-term sustainability of the community care workforce to meet future health demands across Wales? And the statement emphasises the need for consistent access across Wales. The introduction of the primary care cluster dashboard aimed to address, as I mentioned earlier. So I just want to emphasise to you, Cabinet Secretary, what are you doing to make sure that all areas of Wales, whether it's north, south, to east and west, have equal access to services, especially in those pharmacy services when we haven't actually seen everybody being independent prescribers, and it'd be interesting to know what work you're doing around that as well. Deputy Clyward.
Remember, asked a range of questions. I'll do my best to answer at least the key ones. In relation to the £5 billion, those were allocated to expand the workforce right across Wales in terms of allied health professionals. I think what we are seeing is actually the highest level of funding ever allocated to support a record number of training opportunities for the AHP workforce, and that's right across Wales. I touched on the developments in Cwm Taf Morgannwg and in Swansea Bay health boards, but I could have pointed to the frailty practitioners in Powys Teaching Health Board, which I'm sure he will have an interest in. The work which Cardiff and Vale are doing in relation to orthopaedic programme, I mentioned that in my statement, but also Hywel Dda have launched an integrated community stroke service which reduces hospital waiting time. So there's a range of ways right across Wales in each of the health boards in which that funding is being put to very good and productive use, and having demonstrable outcomes, demonstrable impacts on patient outcomes, which is obviously the measure of success in relation to that investment. I mean, he makes an important point in relation to the pressure on GP practices. I think the thrust of my statement was really about highlighting the range of other ways in which people can access primary care services, which have two impacts. One is to reduce the demand on GP services and also to make sure that patients get access to the treatment they need in the most convenient way possible. So it has those two benefits, and I think actually it's important that people do continue to make those choices. We see increasing demand on GP services. Where that demand is capable of being better met elsewhere, frankly, we should be seeking those alternatives. So it should be more convenient for us, but we should also be doing that proactively. So he makes an important point about how one can ensure that the public understand the range of those services. And in a sense, what we're trying to do is bring about generational change in people's access to healthcare. So this will take, I think, many years to embed as a way of understanding how the health service can provide the support that we need. I was at a pharmacy, as I mentioned in my statement this morning, and discussing very much with the pharmacists there the strategies which they had used to work with local GP practices to highlight the range of alternatives. So someone calls up and asks for a GP, there's a conversation which says, well, have you tried your local pharmacist, prescribing pharmacy, so you'll be able to get the support that you need there. So it's ensuring those that's part of the discussion through GP practices, but also in terms of public information campaigns, and also the work that pharmacies themselves do to promote the increasing range of services which they can provide. It's also information which is available through NHS 111, both on the phone and online. So encourage members to point their constituents to those services, and we can all play a part, I think, to encourage people to take up those services. He asked a series of questions in relation to the access to dentistry. Negotiating a contract is an exercise for two parties. It isn't entirely the gift of the government. So these things, have sometimes take longer than, frankly, any of us would wish. But I think it is important to say, there have been a number of reforms to the existing contract, and we've been in a period of annual variation. And whilst each of those has sought to reflect, the consequence and emerging understanding of changes in demand, and obviously there is a gap in demand, a gap in provision in terms of NHS services, which we obviously know and have discussed in this chamber many, many times. you know, I also accept that having an annual set of variations doesn't provide that stable platform, which is important for the resilience of practices and for our ability, you know, to describe with confidence and, you know, in an attractive way what dental practice looks like. So I'm sure we all look forward to the point at which we have that new contract in place, which will, you know, be a new platform to make dentistry, as I said in my statement, both fairer for patients and more attractive for the profession. I can say, as I did in my statement, that we expect to consult on that in the spring. We'll see what the responses to the consultation say. It's obviously a negotiated contract with the BDA, and my expectation is that that will be in place for the early part of next year, so the spring of next year at the latest. And you know, what I've also heard in talking to dentists is that they appreciate a bit more lead-in time for when there are changes to contracts, so they can make the necessary adjustments to their practice. Finally, the member made a point about children's dental health, and in particular, you know, the changes that we've made have released a number of additional appointment capacity for children and young people, and I know that he will be pleased to hear that we continue to invest, for example, in our Design to Smile programme, which the First Minister spoke about in First Minister's questions earlier. 60,000 children and young have benefited from that scheme in the last year. 5,000 teachers and teaching assistants trained to provide those services. So, you know, that is a successful programme, and we know that it makes a real difference.
Thank you, Deputy Lywydd. Primary care is responsible for over